Hi, this video will show you how to use SPSS to perform Mantel-Haenszel methods for analyzing a contingency table, controlling a possible confounding variable. In this study, there are three variables. One is the gender variable, and one is length of sleep, whether they had enough sleep or not before the test, and then the test result. And this is the data. So the data is split into two contingency tables. One is for boy, one for girl, for examining the association between length of sleep and test results. There are three variables. Each has two categories. So totally there are 8 possible joint events. A boy didn't have enough sleep and failed the exam, and there are 20 of them. Boy didn't have enough sleep and passed the exam, there are 100 of them. And then boy had enough sleep, failed. Boy had enough sleep, pass, and the same thing for girls. So there are totally these 8 possible situations, and we put their joint frequency accordingly for each of those possible joint events. So sum them up, this would give us a total sample size. We can use this frequency column to weight these joint events to generate the data for the analysis. To do so, you click Data, Weight Cases, and then check weight cases by and select the frequency and check it in, and then click OK. Now SPSS will consider that there are actually more than 600 data in this data set. To use SPSS to perform the Mantel-Haenszel methods, first I click Analyze and click Descriptive and then Crosstab. Usually I like to use the outcome as a column variable and the risk factor as a row variable, and this gender is the extra layer that we use in this analysis. And let's click on Statistic to do the analysis. Check on Cochrane's and Mantel-Haenszel statistic and click Continue. Then if you click OK, then you get the 2 contingency table, one for boy, one for girl, listed here. There is a test of homogeneity of odds ratio for both Breslow's Day or Tarrant's test. The result all a little bit higher than 0.69. Then there's the Cochrane's test or Mantel-Haensel's test p-value. They're all less than 0.05, means so the association between the two variables is statistically significant. And this is the summary table report to you the estimate of odds ratio. This is the adjusted odds ratio, which is 2.229. And with the p-value for the test of association, that is 0.001. So to do this problem, actually, first of all, we like to know whether the odds ratio for failing the test from boys and from girls are similar or not. Okay, and this can be done by doing this homogeneity test of odds ratio. So since the p-value is higher than 0.05, we can conclude that the odds ratio for both boys and girls are very similar. Then we can combine the both odds ratio to come up with one odds ratio. We can call this adjusted odds ratio, which is 2.229. And then use this odds ratio. We can also test for odds ratio equal to 1 or not, for checking whether there is a significant association between the two variables that we wish to test, which is the sleep variable and test variable. Since the p-value is 0.001, which is less than 0.05, so there is significant association between length of sleep and test result. And by this number, 2.229, we can conclude that if you didn't sleep enough, the odds of failing exam is about 2 times than those who had enough sleep. Now in this analysis, we use the joint frequency information in the contingency table to create this data. And there are 3 variables in this analysis. In some situation, you may not have this contingency table. You have raw data, which means you have gender, sleep, and test, 3 variables. In that case, you don't really have to do weight cases. You don't need the frequency information. You can just go to exactly the same thing that I did earlier to perform the Mantel-Haenszel method, making use of these 3 variables to do the analysis.